There are three major factors that have ensured that disease gets perpetrated in low and middle income countries. Those three factors constitutes vicious cycle, inseparable vicious cycle, which has actually affected many communities in Africa. They include poverty, lack of information or ignorance, disease. These three factors actually constitute serious vicious cycle. One leads to the other and the other leads to the other. Why did I tell this story? Sometime about 6 months ago, I once had a neighbor who lives just below my apartment. You know, this woman is a very dedicated Christian who prays almost every now and then. And, she's being seen as somebody who is after God's heart and all that. So, this lady, on one occasion, I overheard her, having a phone conversation. She was trying to, counsel a church member who actually called her to complain that the wife was having a convulsion, while pregnant. The wife was around 7 months pregnant, and then he called the pastor's wife in order to complain that the wife was having convulsion. Wow, this actually surprised me because the pastor's wife, instead of giving this woman a very good counsel, completely deviated from what the man complained about, and then started telling the man that the reason why the wife was having convulsion while pregnant is because of spiritual attack, that somebody who lives in their compound is actually against the wife, because that was her first pregnancy, and that person has sworn never to allow that woman to get pregnant for him. So, having heard this, the sense struck me, and I had a deeper reflection of what ignorance could do. Is because this pastor's wife is not aware that convulsion in pregnancy in a prima gravida is a medical condition in pregnancy, and that's why she counseled a fellow worshiper that the wife's condition is as a result of spiritual attack. So it's a deeper problem. So after considering all that, I said, I think I need to pick this up and discuss it with my followers. And then that actually, after reflecting on that, I felt that it will be an iceberg of what the condition is in the general population actually, and that is the bane of our societal ill, and why the disease, poverty, and ignorance continue to be a serious vicious, constitute serious vicious cycle in our environment here. What is convulsion during pregnancy? After 20 weeks, it's simply eclampsia, and it's common amongst women who are, pregnant for the first time, and then who are hypertensive in pregnancy, and of course in our environment, majority of women do not actually register for antenatal care on time. They will wait until they start having issues before they run to the hospital. Yeah, a study has shown that in this environment, the mean booking time for antenatal care is around 18 weeks, 20 weeks in this environment. And by that time, majority of the medical conditions pre-existing before the pregnancy would have started disturbing the patient before they start reporting to the hospital. So, and eclampsia is a multi-systemic disorder that affects virtually every organ. It affects the kidney, it affects the liver, it affects the brain, it affects the eyes, and it deals with the pregnancy, that the woman is having. So what am I saying all this? I'm saying all this because we need to begin to pay attention to some of these. We need to be very health conscious. We need to pay attention to some of these things. Eclampsia or convulsion in pregnancy due to hypertension is not caused by spiritual attack. So, what can you do, or what will you do once a woman starts convulsing? First of all, ensure that this patient or the person convulsing is in a safe place. This is very important because once the convulsion starts, they usually will lose consciousness transiently and then recover within few seconds. And once that happens, place the person in a safe place. Ensure that the neck is propped up, that the tongue is not falling back. If there's a spoon around you or a spatula around you, pad it and then put it in between the teeth, to depress the tongue so that the woman can easily breathe in and out. Now, as soon as that convulsion episode is over, just take the person to the hospital. Don't allow the woman to convulse again in your presence. Take the person straight to the hospital. The nearest hospital, where you take the patient is where there is a medical doctor who can attend to the patient. Once the person comes to the hospital, of course, the doctor knows exactly what to do. Check the blood pressure, ensure the blood pressure is, check the blood pressure, ensure it's safe, ensure the airways, that the woman is breathing well, that there's no secretions and all that, and then give the patient oxygen because the patient needs that. And then after that, catheterize the woman if there's need for that, estimate the condition of the baby, control the blood pressure, and then deliver the woman. Once the placenta is out, the baby is delivered, the condition reverses. So you can see it is not a spiritual problem at all. So our problem is poverty, ignorance, and disease. That is exactly what our problem is. And that is exactly why I've taken it upon myself to see if we could begin to reverse this trend by sensitizing our people around here so that we can achieve a common good for our people. Thank you. I will keep on updating you on certain health information and health tips. Please help us to share this video so that people that will see this video, once they see it and then anybody around them starts conversing while pregnant, they will know that this is not spiritual attack but convulsion in pregnancy. That is a medical condition called eclampsia. Thank you. Catch you on the next.